Imagine finding yourself in a routine where daily blood sugar checks and insulin shots become as normal as brushing your teeth. For those managing diabetes, it is a reality that can feel like a never-ending cycle, always calculating the next meal, measuring carbs, planning exercise routines, all while hoping to keep their blood sugar within the target range. Many have seen hope from new medications or dietary trends that emerge, each promising to make diabetes management a little bit easier. Every small improvement brings a ray of optimism, whether it's a less painful glucose monitor or a more effective insulin delivery method. In the face of these challenges, breakthroughs in science continue to emerge, sometimes from the most unexpected places, offering fresh hope in what feels like a complex puzzle. Before we continue, I'd like to tell you about Diacelon, a powerful blend of 13 natural ingredients, each carefully selected for their proven ability to support healthy blood sugar levels, enhance insulin sensitivity, and promote overall wellness. You can read more on Diacelon.com. In recent years, researchers have started to pay more attention to naturally occurring substances in the body, particularly proteins and the tiny molecules that make them up. These molecules have long been known for their roles in processes like muscle growth and tissue repair. They're called amino acids, the building blocks of proteins, but new studies have been turning our attention to their capabilities beyond just building muscle or recovering after a workout. It turns out that some of these molecules, when put together in a specific sequence to form what scientists call peptides, may hold therapeutic power in areas that extend beyond what we traditionally imagined, areas like diabetes management. Imagine a chain of molecules, each one linked to the next, forming a little string of potential. These are peptides, and what makes them so fascinating is their potential to send signals to the cells within our bodies. It's a bit like whispering a code word that tells the cells what to do. The idea that these tiny sequences could play a role in managing diabetes might sound a little far-fetched at first, but it's this whispering that has sparked interest among researchers. Could these sequences instruct the body to use insulin more effectively, or perhaps to release it at just the right time? The answer may be much closer than we realize. Scientists have discovered that peptides can influence metabolic processes, and when it comes to diabetes, that means potentially having an impact on how the body regulates glucose. One of the key problems for people with diabetes is that their bodies either don't produce enough insulin or can't use the insulin they have effectively. Insulin is the hormone responsible for ushering glucose from the bloodstream into cells, where it can be used for energy. When this system doesn't work well, blood sugar levels remain high, leading to complications over time. A particular peptide that has captured attention is GLP-1, which stands for glucagon-like peptide 1. GLP-1 is naturally produced in the gut and plays a role in regulating blood sugar by enhancing insulin secretion and reducing glucagon release. Essentially, it helps balance the scale of blood sugar in a natural way. Researchers have been exploring how we can use this natural mechanism to create more effective diabetes therapies. Instead of just adding more insulin to the body, what if we could work with the body to help it use the insulin it already has? This is where GLP-1 and other peptides come into play. Imagine the simplicity of this approach. Instead of overwhelming the body with medications that do the work for it, we could empower the body to do the work itself. It's like giving someone the tools and knowledge they need rather than doing the job for them. With GLP-1 receptor agonists, scientists have developed a way to mimic the natural effects of GLP-1, encouraging the body to respond in a more balanced way to rising blood sugar levels. This has proven to be a promising avenue, especially for people with type 2 diabetes, where insulin resistance is a major issue. The beauty of peptide therapies doesn't end there. Another peptide, called C-peptide, has shown potential benefits for people with type 1 diabetes. Type 1 diabetes is characterized by the immune system attacking and destroying insulin-producing cells in the pancreas. Increasingly, studies have suggested that C-peptide, which is produced in the pancreas alongside insulin, might have protective properties that benefit the small blood vessels and nerves. This could potentially help reduce complications like neuropathy, which is a common issue for people with type 1 diabetes. The story of peptides in diabetes treatment isn't just about managing blood sugar. It's about reducing the damage that elevated blood sugar can cause throughout the body. It's a step toward treating diabetes in a more holistic way, one that addresses not just the symptoms, but the broader effects of the disease. What's more, ongoing research is examining the potential for those therapies to help regenerate damaged tissue, bringing even more hope to those who have struggled with complications for years. One of the most promising aspects of amino acid and peptide research is how it seems to work in harmony with the body. Unlike some treatments that can come with a long list of side effects, peptide therapies are often well tolerated because they are, essentially, copies of substances that already exist within us. It's like introducing a familiar friend rather than a foreign invader, which could make all the difference in reducing side effects and improving patient outcomes. Some trials have shown improvements in blood sugar control, while others suggest these peptides might even help in reducing body weight. Weight management is crucial for people with diabetes, particularly type 2, as it can significantly improve insulin sensitivity. The dual action of regulating blood sugar and promoting weight loss has sparked significant interest among researchers and healthcare professionals alike. It's hard to overstate the importance of this kind of therapy, especially for those who have struggled for years with managing their condition. For some, the idea of moving away from insulin injections and instead relying on a therapy that works in tandem with the body feels like a step closer to a cure. Though we aren't quite there yet, the progress being made is remarkable, and the science is catching up to the hopes of so many who are waiting for a more effective and less intrusive way to manage diabetes. The story doesn't end with GLP-1 or C-peptide. Researchers are exploring other peptides and combinations of amino acids that might bring additional benefits. One such avenue involves the investigation of peptides that might help protect and even regenerate pancreatic beta cells, the cells responsible for producing insulin. The idea of regenerating these cells has always been a dream for those in the diabetes community. Imagine a therapy that not only helps manage blood sugar levels, but also works to repair the very system that was damaged, bringing the body closer to its natural state. We're seeing glimpses of a future where diabetes management could be far less burdensome. A future where the tools to regulate blood sugar are not only external, but are supported by the body's own mechanisms, coked back into functionality by these peptide therapies. With each study, researchers are learning more about how to harness the body's potential for healing, offering new hope to millions worldwide. The good news doesn't mean we can be complacent. These breakthroughs, as promising as they are, require time for further testing, refinement, and approval. But if you ask those who have been following the progress, they'll tell you this feels like more than just another trend. It feels like a meaningful advance that could change the landscape of diabetes treatment forever. Peptide therapies represent a shift in how we think about treating chronic illnesses, one that relies less on merely masking symptoms and more on working with the body to restore balance. For those living with diabetes, the hope is not just about fewer injections or better numbers on a glucose meter. It's about the possibility of living with less worry, fewer complications, and the potential for a life that feels a little less like it revolves around diabetes and a little more like it's their own. These are still early days, but the progress being made with amino acids and peptides feels like a true game changer for diabetes care. If you or someone you know has diabetes, it's worth keeping an eye on these developments. Peptides and amino acids might seem like a small part of the broader story of diabetes treatment, but they are becoming a bigger part of the conversation with every passing day. The future of diabetes management is looking brighter, with these natural molecules leading the way, whispering to our bodies to remember what balance feels like, and maybe, just maybe, bringing us one step closer to it.